of the pharmacology discussions. And since this was a request from one of the students that, sir, in pharmacology, do please upload videos on the corticosteroids. So here I am with the video. And today's video will be mainly focusing upon the amongst the corticosteroid drugs. We will be mainly focusing. The topic what I have chosen is about the glucocorticoids. So students, in the most of the professional exams, when it comes to writing about the therapeutic uses and the adverse effects, it becomes very difficult to pen down in sequence about the therapeutic uses and the adverse effects of the glucocorticoids. So here I am with the mnemonic as to how we can very easily memorize and write in the exams, particularly in the professional exams, about the therapeutic uses and the adverse effects. So in this video, I'll be mainly focusing upon the therapeutic uses and the adverse effects of the glucocorticoids in the form of simple mnemonics. So students, beginning with the therapeutic uses of the glucocorticoids, this can be better remembered or memorized just by remembering the alphabets of the alphabetical order, that is A, B, C, D, E, F, G, H, I. Up till I, we are going to have the entire alphabetical series, and excluding the J, we have the K and the L. So students, just by remembering the alphabetical order, that is A, B, C, D, E, F, G, H, I, and excluding J, we have K and L, we can very easily summarize and pen down in the professional exams about the therapeutic uses about the therapeutic uses of the glucocorticoids. So students, beginning with the first A of the alphabet, the A is referring to the arthritis and in severe allergic reactions. So students, glucocorticoids find their wide usage in the treatment of arthritis and in cases of severe allergic reactions. Moving on to the B of the alphabetical order, that is B is referring to the bronchial treatment of bronchial asthma and in the treatment of Bell's palsy. So students, do remember the B stands for the treatment of bronchial asthma and Bell's palsy. Glucocorticoids form the drug of choice. Moving on to the next alphabet, that is the C. The C here refers to the collagen disorders. So various types of collagen disorders such as the systemic lupus erythematosus and Wegener's granulomatosis, they are treated by the glucocorticoids. Moving on to the next alphabet, that is E. E here refers to the eye inflammatory conditions. So glucocorticoids drugs, they find their wide usage in the treatment of various types of eye inflammatory conditions. The F of the alphabetical series, the F is going to refer to the fever. So the F of the fever, it refers to fever, and that too particularly the fever which is of an inflammatory origin. They are the drug of choice. The glucocorticoids are the drug of choice in that particular kind of fever. Moving on to the G. The G here refers to the gastrointestinal inflammatory conditions. So there are certain kinds of inflammatory bowel diseases which are very widely treated by the use of glucocorticoids. So the G of the alphabetical series refers to the gastrointestinal inflammatory conditions. Moving on to the H. So the H of the alphabetical series refers to the hematologic disorders and in the treatment of hormone replacement therapy. So students, the hormone replacement therapy is one of the endocrine uses of the glucocorticoids, and under this category we are going to have the two basic types of hormone replacement therapy, that is in cases of acute adrenal insufficiency and in the treatment of chronic adrenal insufficiency. Moving on to the next alphabet, that is I. So I here refers to the immunosuppressant. The glucocorticoids find their uses in the treatment of certain immunes as an immunosuppressant, and it is also as an anti-cancer drug. Moving on to the alphabet, that is K. I have excluded the J, has been skipped off. The K here refers to in the treatment of various kinds of kidney diseases also, the glucocorticoids find their wide usage. So the K refers to the kidney diseases, and the K is and in the kidney diseases, the glucocorticoids find the first line drug of choice. What is there in kidney diseases, that is first line drug of choice in nephrotic syndrome, the glucocorticoids, they are the first line drug of choice what is used in the kidney diseases, that is in the treatment of nephrotic syndrome. Moving on to the last alphabet of the alphabetical order, that is L. L here refers to the treatment of lung diseases such as aspiration pneumonia and the infant respiratory distress syndrome. The glucocorticoids find their therapeutic use. So, and the final L, the L also refers to in the treatment of certain liver diseases. So glucocorticoids find their wide uses in the treatment of chronic active hepatitis as well as alcoholic hepatitis. So students, this was a short discussion about the therapeutic uses of the glucocorticoids in the simple mnemonic form, that is proceeding in the form of the alphabetical order, that is A, B, C, D, E, F, G, H, I. Excluding the J, we have K and L. So just by remembering the series of the alphabetical order, we can very easily pen down in the professional exams about the therapeutic uses of the glucocorticoids. So the students, I would like to specify over here, that is the uses up till, that is arthritis, bronchial asthma, and Bell's palsy. C is collagen disorders. D stands for the dermatological disorders. I in eye inflammatory conditions. F in the fever, in the treatment of fever, that is inflammatory, the fever which is of an inflammatory origin. And G, that is the gastrointestinal inflammatory conditions. These all, they come under the anti-inflammatory effect, the anti-inflammatory therapeutic uses of the glucocorticoids. Moving on to the next, that is the another topic what I'll be emphasizing over here, that is the adverse effects of the glucocorticoids. So students, in the professional exams, it again becomes very difficult to write about the adverse effects of the glucocorticoids. So the adverse effects of the glucocorticoids can be better remembered if we just look at the initials of the letter glucocorticoids. So glucocorticoids, every alphabet of the G, L, U, C, O, C, O, R, T, I, C, O, I, D will correspond to one of the adverse effects. So the first G of the glucocorticoid is referring to the glucose level increases. So the adverse effects of the glucocorticoids can be seen in the treatment, can be seen in the form of that there can occur the glucose level of the patient can suddenly rise, and ultimately the patient may manifest in the patient diabetes mellitus may be precipitated. So students, the first adverse effects is from the alphabet G of the glucocorticoids, where the glucose level in the blood of the patient is going to rise, and ultimately the patient may be precipitated with diabetes mellitus. Moving on to the L. So the L here refers to the long time to heal. So patients who are on corticosteroid therapy, there has been found if there is certain kind of an infection or if there is certain kind of a wound, that is not going to heal for a longer time. So the L here refers to that the wounds or the infections or the wounds, they take a longer time to heal in patients who are on corticosteroid therapy. Moving on to the U. So the U stands for the ulcer, that is peptic ulcer. So the patients who are on corticosteroid therapy, they show, some certain patients, they show that there is a possibility that the patients can show certain kinds of peptic ulcer. This has been reported in certain patients. Moving on to the C, or the first C of the glucocorticoids, it refers to the Cushing's habitus. So students, Cushing's habitus, it is a kind of a disorder in which there is an abnormal distribution of fat. The patient may exhibit a moon-like face. Along with, there can be presence of a buffalo hump, and there can occur truncal obesity also. So the first C of the glucocorticoids the adverse effect can be seen in certain patients in the form of Cushing's habitus. So Cushing's habitus features I have discussed. Moving on to the first O of the glucocorticoids, that is the O, it is going to refer to the osteoporosis and myopathy. So one of another adverse effect, what can be seen? It is the in certain patients osteoporosis as well as myopathy can also be seen. Moving on to the first C of the glucocorticoids, this C is referring to the CNS disorders. So the one another adverse effect, what can be seen in some of the patients, it has been found that certain central nervous system CNS disorders, what can be seen, it is in the form of insomnia as well as psychosis. So certain patients may also exhibit the signs of insomnia and psychosis. Moving on to the next O of the glucocorticoids, that is the O is referring to the ocular diseases. So in certain patients, the adverse effects can be manifested in the form of ocular diseases, particularly the cataract and the glaucoma can also be precipitated in certain patients as an adverse effect. Moving on to the R of the glucocorticoids, that is the R is referring to the retardation of growth. So students, another adverse effects what can be seen in some of the patients, that there can occur a stunted growth or a certain kind of a retardation of growth is also seen in some patients. Moving on to the T of the glucocorticoids, the T is referring to the thin, fragile skin. So students, there are the adverse effects, another adverse effects can be seen in the certain patients in the form of that they'll be having a thin, fragile skin due to long-term usage of glucocorticoids. Moving on to the next I of the glucocorticoids, it refers to the immune suppression. So students, the patients, this has been a very important point in the adverse effects, because the patients who are on a continuous use of glucocorticoids, there has been found that they are predisposed to certain kinds of infections. There can the patients who are on a long-term glucocorticoid therapy, their immunes is being suppressed. The phenomena of immune suppression is seen, and the patients, they are mostly predisposed to various kinds of infections. Okay, moving on to the next C of the glucocorticoids. So C here refers to the congestive heart failure, O refers to the edema, and I refers to the increase in blood pressure. So the congestive heart failure, CHF, edema, and increase in blood pressure, these are the three adverse effects what is seen as an adverse effect to glucocorticoids, particularly the cause being due to salt and water retention. So students, these three side effects, the adverse effect, that is CHF, the congestive heart failure, edema, and increase in blood pressure, it is due to salt and water retention. Moving on to the last D of the alphabet, that is glucocorticoid, the last D, it is referring to the depression of the hypothalamic pituitary adrenal axis. So students, this was a short discussion about the therapeutic uses as well as the adverse effects of the glucocorticoids. And in this way, I have summarized about the glucocorticoids, the therapeutic uses and the adverse effects. Students, if you do like this video, give this video a thumbs up, and don't forget to, if you are visiting my channel for the first time, just don't forget to subscribe and share. So there was a request from one of the students. Surely I'll be posting videos on chemotherapy. I'll take this into consideration, and surely I'll be coming up with the topic on chemotherapy. Thank you for watching, students. Thank you.